Hello, everyone, and welcome to the very first episode of Pharmacology for Nurses. My name is Megan, and I'll be your guide as we explore everything you need to know about pharmacology, from understanding mechanism of actions all the way to providing patient education. So, whether you're currently taking a pharmacology class, maybe you're gearing up for the NCLEX, or just looking to strengthen your nursing knowledge, this podcast is here to help you navigate one of the most challenging yet fascinating, in my opinion, areas of nursing practice. So, today's episode is going to be our introduction. We're going to talk about why pharmacology is so tough for many students, strategies to help you ace those exams, and a preview of what to expect in future episodes of this podcast. So, get comfortable. If you have, maybe grab a notebook and let's jump in. First, I want to quickly introduce myself. I've been a nurse for 10 years and I've been an educator for 4. I've been teaching pharmacology for the past 4 years in addition to classes like health assessment and pediatrics. I've also done some clinical instructing and worked in simulations and labs. So, why is pharmacology so challenging? Pharmacology, just hearing the word can send a chill down many nursing students' spines. Why is it such a monster of a course? Well, there's a few big reasons. First is just the sheer volume of information. You'll find yourself memorizing hundreds of drug names, both brand and generic, along with classifications, mechanism of action, side effects, contraindications, and blah, 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 even more. It can feel like you're trying to stuff an entire library into your brain for just one drug. There's also abstract mechanisms. Understanding how and why drugs work require really a solid grasp of physiology and pathophysiology. When you're told a medication is a beta-1 adrenergic receptor antagonist, what does that mean? You have to recall what beta-1 receptors do, where they're located, and how blocking them is going to affect the body. It's not just rote memorization that you can pull off with other courses. You really have to have conceptual thinking to be successful in pharmacology. There's also critical patient safety implications. Pharmacology is high stakes. Giving the wrong dose or the wrong drug can be life-threatening. So the pressure is really on, and that can make the learning curve a lot steeper. We have the rapid evolution of medications as well. Remember, new drugs are introduced regularly, guidelines are changing, and older meds have updates or new black box warnings all the time. So pharmacology is really a dynamic subject. You need to stay current even after you graduate. Most students struggle because it's not like your typical memorization heavy course. There's an underlying logic to how drugs work, and you can't get away with just flashcards. You need to link your knowledge of body systems, disease processes, and specific actions of a medication. So that's where Pharmacology for Nurses come in. Across these episodes, I'm going to demystify those pesky classifications, highlight mechanism of actions, we'll walk through real-world nursing considerations, give you my best tips on how to study so you're not feeling so overwhelmed. We'll approach it in a systematic way, usually starting with drug classes like beta blockers, ACE inhibitors, opioids, etc., and then drilling down into common medications that you're likely to see in clinicals, on exams, and in the NCLEX. I'll also be sprinkling in patient scenarios or test questions, which are going to be perfect for that NCLEX style practice. But before we dive deeper into how we'll break down each episode, let's tackle a topic that's near and dear to any nursing student's heart, which is test taking tips. So pharmacology questions can be particularly tricky. So here's some pointers. First, you need to understand the why behind the drug. Don't just memorize that metoprolol lowers blood pressure. Know why it does that. If you remember it's a beta-1 blocker that reduces heart rate and myocardial contractility, you'll naturally connect that to fewer palpitations, lower cardiac output, and thus lower blood pressure. That deeper understanding is going to help you answer tricky select all that apply questions. I also want you to start focusing on prototypes. So each drug class typically has a prototype medication that demonstrates the group's main characteristics. For example, penicillin is a classic prototype for beta-lactam antibiotics. Learn this prototype well, and you can usually extrapolate how similar drugs in that class behave. This technique reduces the amount of raw memorization. Don't spend your time memorizing every single drug individually. Use the nursing practice: assessment, diagnosis, planning, implementation, and evaluation. So for your assessment, you want to focus on what do you check before giving a drug: blood pressure, heart rate, labs, etc. For diagnosis, what is this medication appropriate for the patient's condition? Planning, when and how will you administer this medication? For implementation, how do you administer it safely? Is it IV push rate you need to focus on? Dilution? Evaluation, did the medication work? Are there any side effects or adverse reactions? Pharmacology questions often revolve around these steps, especially the assessment and evaluation part. You need to start looking for clues in the question stem. NCLEX style questions usually include hints about side effects, lab results, or patient conditions that should guide your answer. If they mention the patient has a history of peptic ulcer disease, for instance, you might be cautious with NSAIDs or corticosteroids. Remember your ABCs: airway, breathing, circulation, and Maslow's hierarchy of needs when deciding on the best action. If the question suggests the drug caused anaphylaxis, your immediate priority is often to stop the infusion and maintain the airway, rather than call the doctor first. And this is something a lot of students get mixed up on. Next, beware of sound-alike or look-alike drugs. The NCLEX loves to test medication safety. Do not confuse hydralazine with hydroxyzine or benztropine with benzonatate. Read carefully. Test taking in pharmacology can be stressful, but following strategies will help you eliminate wrong options and identify the best answer based on pharmacological knowledge and nursing practices. Now, let's talk about what's in store for upcoming episodes. We'll systematically cover topics like medication classes. For example, we'll dive into antihypertensives like beta blockers, ACE inhibitors, ARBs, calcium channel blockers, and outline everything from mechanism to side effects and crucial nursing assessments. High alert medications such as anticoagulants, insulin, opioids. We'll talk about common errors, how to avoid them, and what to do when they happen. Special populations are also going to be a focus. Pediatrics, geriatrics, pregnancy, and lactation each have unique considerations we need to know. And then we might touch on vaccines and immunizations, understanding how they work and how to educate patients effectively. I also personally love case studies. So in these episodes, we'll present realistic patient scenarios that help you link pathophysiology with appropriate pharmacological interventions. Throughout each episode, we'll introduce the drug class and typical uses, explain how the drug works in your body, list key side effects, contraindications, interactions, highlight specific nursing considerations like the labs that you need to remember to check, assessments you need to make sure to complete, and we'll offer patient teaching tips because education is so crucial and it always shows up on the NCLEX. Let's do a brief example right now. So suppose we're talking about beta blockers. Our mechanism of action is that they're going to block our beta-1 adrenergic receptors in the heart. They're going to reduce that heart rate and that contractility. So because of this, our indications are hypertension, angina, post-MI management, and sometimes even anxiety. Side effects can be bradycardia because we're lowering that heart rate, hypotension, we're lowering blood pressure, fatigue because we're reducing the overall cardiac output that's going to be pushed to the body, so we have less blood going to all the muscles, bronchospasm in our non-selective beta blockers because they're going to interact with those beta-2 receptors in the lungs. We might want to focus on our contraindications. That's going to be our asthma and our COPD, again, for those non-selective beta blockers. Anyone who has an AV block or severe bradycardia because we're already lowering the heart rate when we give these medications. We're going to touch on our nursing considerations. So for our beta blockers, we need to check that heart rate and blood pressure before administering, and remember to hold the med if you have a heart rate less than 60 or a systolic blood pressure less than 90. And caution in diabetics. Remember, our beta blockers are going to mask hypoglycemia symptoms. Patient education, we would dive into how to remind our patients not to abruptly stop this medication. It can cause rebound tachycardia. Monitor for dizziness because of that lower blood pressure, and check your pulse regularly. I might ask an NCLEX style question like, a patient on metoprolol has a heart rate of 54. What's the best action? And your options might be things like administer the dose anyway, hold the dose and notify the provider, double check if they're on other meds, or encourage the patient to ambulate to see if the heart rate increases. In this example, our correct response is holding that medication because the heart rate is below 60. You can see how a little knowledge of mechanisms such as it's slowing the heart rate and assessment, remembering to check vitals, and the priority nursing consideration, hold if it's too low, is going to help you answer this question properly. Now, this was an easy one, But we really need to focus on the integrated thinking that comes along with these medications and exactly what NCLEX and real nursing practice demand. So that's going to be the flavor of how our episodes go, a mix of explanations, practice examples, and test taking style questions that NCLEX focus. My goal is to make pharmacology feel less like memorizing from a phone book and more like connecting logical dots. Don't forget, we're going to tackle big topics in manageable chunks, use real scenarios, and keep bridging the gap between theory and practice. So let's wrap up our first episode. Here are some final pieces of advice that I want to leave you with. Our first tip is write out drug concept maps, class name, mechanism of action, side effects, nursing considerations, and a quick note about why, when, and how to give it. If you're struggling on this, check out pharmacologyfornurses.com and look at the medication templates available there. Tip number 2, take advantage of study groups. Explaining a drug to your peers is one of the best ways to learn. Teach it out loud. Tip number 3, when you study, try to visualize yourself in clinical practice. Ask, if I had a real patient on this medication, what would I watch for? What would I teach them? Tip 4, don't neglect lab values that matter for each medication. PT, INR for warfarin, maybe serum creatinine for nephrotoxic drugs. And tip 5, lastly, use resources. Use your drug guide, reputable online sources, and yes, podcasts like this one. And don't forget to check out the Pharmacology for Nurses study guide available at pharmacologyfornurses.com. All right, we have reached the end of our first introductory episode of Pharmacology for Nurses. We've covered why pharmacology is so challenging, some proven test-taking tips to help you pass and really truly understand the medications, a quick look at how our future episodes will be organized, and overall, I hope you're feeling more confident and motivated to dive into this subject. Pharmacology doesn't have to be your biggest nemesis. With the right approach, it can become one of the most rewarding parts of your nursing journey because when you understand the meds deeply, you can provide safer, more effective care for your patients. So let's chat about what's next. Our very next episode, we're going to start examining cardiovascular medications. We're going to do part 1 of antihypertensives because there's a lot of medications that you will see that are used to help lower blood pressure. So these are going to be a top priority in clinical practice and on the NCLEX. For the next episode, we're going to talk about ACE inhibitors, ARBs, beta blockers, and calcium channel blockers. So stay tuned. If you found this helpful, please subscribe and share it with your classmates or your coworkers. I'd love to hear your questions or suggestions. You can reach out to me at megan@pharmacologyfornurses.com. You can go to Pharmacology for Nurses on Instagram, TikTok, and YouTube. Tell me what you'd like covered or ask me pharmacology-related questions. Until next time, keep learning, keep practicing, and remember, every medication has a story. Learn it, and you'll never be stumped in clinicals or on your exam again. Thank you so much for listening to Pharmacology for Nurses, and I will see you at our next episode.